day, sir. I am Roxanne Gaycago, the second-year nursing student at the University of Southern Mindanao. So today, I'm going to perform to you C technique for intramuscular injection. So it is the introduction of oily or viscous medication deep into the muscle tissue by chosen muscle site. So the first procedure we need to do is to verify the order of the physician, of course, comparing to the medication ticket or the medicine ticket prescribed by the physician. Next is we're going to obtain the equipment and assemble all the equipment, the needle and the syringe into the injection tray. So we have next to get the drug from the patient medication box. So we have here example, the patient medication box, and check it with the medication ticket. For example, when we are going to checking or we're going to see the medication, drug, and the medication ticket, we need to visual it by eye level. Next is we're going to wash our hands, so assuming already done washing my hand. Next, we're going to withdraw the drug with the prescribed amount of dosage, and I'm also assuming that we're already done aspirating. So assuming that we're already done aspirating. So next is we need to get the right amount of dosage that we need. Wait, sorry for that. So assuming that I already have the right amount of dosage for the right patient, next is we're going to change the aspirating needle with the injection needle and place it on the injection tray. So after that, we're going to place it on the tray with our medicine ticket. So next is we're going to present it to the CI for the checking and confirmation of the medicine. So if the CI approve the preparation, we're going to confirm, carries the tray to the patient bedside. So now we are here in the bedside of the patient, assuming. Next is we're going to confirm the patient identity by asking the state of his name or by checking the wristband. So good, and of course need to explain the procedure. So good day, sir. May I know your name? Mr. Bagkat. Okay, sir. Sir, can I see your wrist? Okay, sir. Thank you, sir. Sir, I'm going to inject you, sir. It's okay po ba, sir? Okay, sir. Thank you so much, sir. Oh, yes, sir. Then, after that, we're going to select the appropriate injection site and locate the site correctly. So, assuming that we already hear the site for the injection, next is we're going to cleanse the site with the cotton balls with a 70% solution alcohol, and then we're going to do it in a circular motion moving outward. So assuming, then dispose, then gently but firmly use our non-dominant hand rather, to pull the skin in one direction away from the site of the injection. So we have here the non-dominant hand. We're going to gently but firmly use to pull the skin. So we're going to pull the skin. Oh. Assuming that I already pulled the skin with the exact amount of preparation or the prepared medication we have done, we're going to insert the needle into a 90-degree angle to the skin while continuing the hold of the patient muscle using not pushing, make sure not pushing, or rather 90-degree angle to the skin while continuing hold the skin with the other hand. So again, 90-degree. So after that, we're going to pulse the plunger, and if there is no blood coming from the or coming up from the needle or the syringe, then we can proceed. But if you see blood, you're going to repeat the procedure and change the injection. Then we're going to slowly inject the medication into the patient muscle. Make sure not pushing it too hard or not pushing it the needle for not pushing it further while pushing the plunger. So continue hold the skin. So next is we're going to remove the needle by pulling the entire syringe, and of course straight out the muscle in the same angle that was inserted, and we're going to release the skin to allow the return to its originals. And of course, position, we're going to make it put pressure slightly with it, and then we're going to pull the skin and soft tissue to cover the tract once it is released to prevent the leaking. Next, we're going to keep the injection site clean and covered. Do not rub the injection site. So we're not going to rub it, and assuming that already plastered it, we're going to make the patient comfortable, and we're going to turn back the ticket for it is finished or for confirming that it's already done. And then of course, thus put the medication ticket at the box promptly, assuming that already put it on the box. Next is we're going to dust aftercare. So assuming that already done disposes equipment and use properly, wash hands. So assuming I already washed my hand and remove my glove, we're going to record the time and date of injection, amount of the site, route, and the patient reaction to the procedure. And of course, the observation you have seen on the procedure, subjective or either objective. This for the further comparison of data. That would be all for the Z technique of intramuscular injection, and thank you.